All right, we'll go ahead and kick it off here. Hello, and thank you for joining us today on our COVID-19 vaccine Facebook Live updates. Here at Network Health, it's really important for us to be able to share the latest on vaccines for the state of Wisconsin. I'm joined today by Andy Wheaton. He is our manager of pharmacy benefits. And we also have Kelly in the chat here. She will be able to include any links or relevant information that we talk about that you might want to click on and learn a little bit more. If at any time during our Facebook Live you have any comments, or any time after you have comments or questions, feel free to drop them in the comment section below. And Andy, I'll let you go ahead and kick it off by introducing yourself and telling us why you are our COVID-19 vaccine expert here at Network Health.
Absolutely. Thank you, Chelsea. So as she mentioned, I am the manager of the pharmacy department and a pharmacist here at Network Health. This past fall, I co-led our Medicare flu events that were COVID friendly, and now trying to provide some of the updated information on COVID-19 vaccinations throughout the state of Wisconsin.
Wonderful. So we'll go ahead and kick it off here. We know that everyone in the state of Wisconsin now over the age of 16 is available to get a vaccine. Can you tell us where and how you can get vaccines?
Yeah, so I encourage everyone to take a look at our Network Health website. We have an interactive map that is through the Wisconsin Department of Health Services that they maintain. And in the future, that's actually going to be replaced by the Vaccine Finder website, which is something that the CDC manages, and it's vaccinefinder.org. I believe Kelly will put that in the chat box there. So that would be a great resource to go to wherever you're located throughout the state. You can click on whatever clinic or pharmacy that you choose to get your vaccine, and then that links to set up an appointment for you. So a very, very great resource there. From a supply standpoint, what we're seeing is the vaccine locations will open up their vaccine slots typically over the weekend. That's when they get their allocation numbers and they can understand how much supply they're going to have. And then, so take a look at that time frame. So Saturday, Sunday, look for your appointment. It's even opening up throughout the week. So keep checking back if you see that some of the appointments are booked. Keep checking back because they are available throughout the state in our service area.
Wonderful. Thank you for that info. I do know that we have some clinics around the state in some of the more major cities that are offering walk-in clinics too, which is really great for folks who just want to walk in and don't necessarily want to mess around with any scheduling. There are options for walk-in clinics as well. Can you tell us a little bit more just about the safety and effectiveness of this vaccine? We know it came much faster than a lot of us were expecting, or they kind of talked about at the beginning of this pandemic. Can you tell us how they were able to develop this vaccine so quickly and get it out to people, and how it's safe if it's been developed this quickly?
Yeah. So I just want to remind everybody that all three vaccines are highly effective against preventing the coronavirus and preventing, including serious disease, hospitalization, and even death. So all three of them do a fantastic job at that. As a reminder, you're not fully protected until after your 14 days after your last shot. So if you're on the Johnson & Johnson regimen, that would be after that one dose. If you're on the Moderna or the Pfizer regimen, that's after that second dose, so 14 days after that. In general, side effects typically are accustomed to that site reaction, that sore arm, something I had when I got my vaccinations. But other than that, probably the biggest ones are fatigue and headache. And those happen roughly 50% of the time. Those are common and expected. So I want to make sure everybody's aware of that. That's not necessarily an unexpected consequence of getting the vaccine. We do expect that. So that's good. Some of the big reasons why the vaccine was developed so quickly, and we've talked about this in some of the other Facebook Live discussions, but this was a vaccine that was developed as a global effort. So scientists throughout the world combined their research capabilities and really focused all at the same time to create these vaccines. This was unprecedented. So that's one of the main reasons why we saw this. Another reason is unlimited money. For the most part, the knowledge, manpower, technology, all the funding that needed to happen took place very quickly, actually, and so that researchers could start their work and start to develop this vaccine. Another thing is the vaccine trials. In general, trials tend to have some issues with recruiting trial participants, and with the vaccine trials, we didn't have any of that delay. So everybody raised their hand, and said, let me participate. I want to get the vaccine and be a part of this and really do that. And then the final thing is the overlapping phases of the clinical trials. Most clinical trials will kind of go end to end, the different phases. So phase 1 and 2. This one actually overlapped. So once one part of the trial was done, the other part was already started. And then that also included the manufacturing process. So we were able to get these vaccines out in record time. They didn't cut any corners on the research. So we're in great shape because of it, and very thankful as well.
Good to hear. It sounds like a lot of things for this vaccine just kind of came together all at once. That doesn't usually happen that way when we're developing a normal vaccine.
Right.
Wonderful. So I know we'll kind of touch on some news updates, but I wanted to touch on something that we kind of discussed prior to when we were coordinating this live, is about folks getting that second shot. There's a rising number of people who are not getting that second shot. So can we touch on some reasons why that might not be happening and what people might need to know about getting the second shot? I know I just got mine on Friday, which I was very thrilled to. And for those who might be worried about some of the side effects, I would compare mine to a slight hangover. So if you've ever had a couple too many drinks, you're prepared for that second shot and those side effects. But can you kind of just talk about people who may not want to get the second shot, or kind of reasons why that we're seeing those numbers drop off with people getting the first one and then not getting that second?
Yeah, so you mentioned some of the side effect concerns, and we've talked about that, the headache, the fatigue, and some of those. Obviously, we've heard about the Johnson & Johnson vaccine and the pause there, and we'll get to some of that update in a little bit, but that's also causing some hesitancy in getting that second dose. Those concerns, although there is a concern there, it's very, very, very rare. So I just want to make sure everybody's aware of that. The safety of these vaccines has been demonstrated through the clinical trials, as well as over the past 4 to 5 months as we've all started to get the vaccine. So I have no concerns there. As far as that second dose, I want to make sure that everybody is aware that most clinics or pharmacies, after you've received your first dose, they'll actually start to schedule that second dose. So make sure that you have a plan in place. Many of them will send you a text message or an email or even a phone call afterwards, just to make sure that you remember to sign up for that second dose, or to come in for that second dose. Recently, the U.S. was just kind of just opened up the information that they were told to offer the second doses to people that got their first doses somewhere else. So say I got my first dose down in the Madison area at a clinic down there. In general, prior to this past month or so, the supply really focused on getting those second doses to the actual spot that you received your first one. That's no longer the case. The supply is opening up to a point where we can say, I'm down in Madison, now I can come back up to the Appleton or the Fox Valley area and find a vaccine there. So that's something that has changed over the past probably week or so. That's a little bit different. So that's great for getting those second doses, especially in instances where you've received it in another location.
That's fantastic and great to know. I know that was going to be kind of one of my follow-up questions. If you get it somewhere, can you go to a different clinic, or can you walk in somewhere else that has walk-in availability and say, I've already gotten my first shot, can I get the second? So that's fantastic news to hear. So let's go ahead and jump into the news updates this week. I know we had a really big one yesterday, which I'm sure a lot of us saw and are really excited about. And then we do have new news on Johnson & Johnson. So can you tell us a little bit more about the updates?
Yeah, so let's start with the Johnson & Johnson update. So last Friday, the CDC Advisory Committee on Immunization Practices, it's called ACIP, they recommended to bring the Johnson & Johnson, the one-shot vaccine, back into circulation. It does come with a warning, which we expected for women less than 50 years of age, just noting that there's a potential, a very is, like I mentioned, it's extremely rare, but it's a potential for a rare blood clot. And they term it thrombosis with thrombocytopenia syndrome. That's a mouthful there, or TTS. And this clotting disorder has an incidence of about 1.9 cases per million. So ultra rare, but they wanted to make sure that women understand this, and also the healthcare providers know how to treat this if they come in. If you experience some of the symptoms of this blood clot and you come into the doctor's office or the hospital, they know how to treat this type of disorder, so that they can get you on your way. So that's probably the big thing. We want to just make sure that people are aware of that and are still working through and getting that Johnson & Johnson vaccine. The other big news is the CDC yesterday unveiled their updated guidelines for detailing activities that vaccinated people can safely resume. And this includes small outdoor gatherings, which we're all looking forward to do, especially as we're coming into summertime. So I believe Kelly was going to put this in the chat box, a link to the actual CDC guidance on what we can start to do. This includes attending small outdoor gatherings with fully vaccinated family and friends. We can start to exercise outside without our masks on. There's a couple of other ones. I won't go into all of them, but this is great news for us as we start to get nicer in the state of Wisconsin, right? And we all look to get out and visit with friends and family.
Absolutely. Another reason to get vaccinated, so you can kind of participate in those things and know that you're totally safe, or much safer than you would be without it. Sorry. Can we talk about where current case numbers are at versus vaccination numbers in the state of Wisconsin?
Yeah, so we continue to hear about a potential second or another wave. We won't call it a second wave, but another wave of positive coronavirus cases, not only in the state, but throughout the U.S. In the state of Wisconsin, our current 7-day average is about 3.1%, and that is trending down at the moment, which is great, and that means either we're getting vaccinated or we continue to take those precautions. As expected, the highest percentage of positive cases continues to be the younger population, so those that are under 35 years of age, which makes sense. You know, this is the group that is newly eligible to get vaccinated. So as our vaccinations go up in this particular population, we should start to see that positivity rate continue to go down, especially in the 16 to 35 years of age. Again, we continue to encourage social distancing and face masks as the CDC guidance recommends. For our Medicare population, we're at about 74%. We're actually over 74% at this point, which is fantastic. It's great news. Our older population is well protected. And our commercial population, so those that are generally under the 65 years of age, they're catching up. You know, now that they have the access to the vaccinations, they're catching up. So looking forward to seeing those numbers throughout the next couple weeks.
Yeah, that's great news. And it's going to be exciting to see those numbers as they continue. I've got one more question for you before we start to kind of wrap here. I don't see any questions from any of our listeners. So if anyone has any questions, feel free to drop them in now, or again, comment and we can reach out to you after the fact. But my last question, and it's one I've been kind of asking in previous lives here, is how do I convince a family or family member, friend, loved one who may not be sure of the vaccine, and how do I talk to someone who's unsure about getting the vaccine to sort of help them decide on the vaccine?
Sure. Yeah, so my recommendation has always been we got to focus on the facts. There's a lot of misinformation out there, especially online, social media. We want to make sure that the facts are presented so that when you start to make that decision, you can make an educated decision, an informed decision. So I focus on the facts. Let's look at the effectiveness of the vaccine. It is highly effective. So all three of the vaccines that are currently approved are highly effective against preventing serious disease, hospitalizations, and even deaths. The risk of COVID compared to getting another common virus, say the flu virus, is much higher in the risk associated with that. So there was one Canadian study that I saw recently that said the risk of hospitalization and death after coronavirus, after getting COVID, is about 3.5 times higher than a flu. So just the severity of disease, definitely don't want to scare anybody into getting the vaccine, but this is facts. I mean, this is one of the big reasons why we want to get people vaccinated. We also look at the number of people that are contracting COVID-19 after getting vaccinated. So I saw a study that came out, so 5,800 people out of about 77 million actually got COVID after getting the vaccine, which is extremely low number. So that just means that the vaccine works, it helps protect us, and as well as those around us that aren't able to get vaccinated, especially those younger populations that are under 16 at this point. So make sure we have a plan, get out there and get vaccinated.
Absolutely. Thank you so much, Andy. I don't see any questions right now, so we will go ahead and wrap it up here. Thank you so much for joining us. Thank you, Andy, for answering our questions. Do you have any final thoughts for us before we sign off?
Nope. I think just make sure to get out and get vaccinated. If you haven't done so already, there's plenty of opportunities throughout Northeast and Southeast Wisconsin, and just make sure to have a plan.
Wonderful. Thank you so much. And we will be back next week for another Facebook Live update on COVID-19 vaccines in Wisconsin. Thanks.
Thank you.